Professor Fidelis Njokanma. You're welcome, sir. Thank you very much. Namago. Please, let's have the slides up. Having paid homage, as I rightly should, and by so doing, satisfying also the retinue of traditional leaders of the town, I will extend my gratitude to Department of Pediatrics, FMC Asaba, and the management of FMC and the entire community, FMC. Thank you very much for doing me the honor of asking me to deliver this lecture. I will greet my other lords, spiritual and temporal, professional and academic. I greet the Okolo family, the people, and the Anene family here. I greet the Monus and the Ajaji people among us. Ndonu Ozama Amazing. I greet the ladies and knights. Is it knights and ladies or ladies and knights? All right, knights and ladies of St. Pulumba. I greet our friends, brothers, and sisters from far and near. I just noticed the provost of the medical school in Benin, Professor Sadu. You're welcome, sir. Yes. This is a farewell. Oh boy. Can I get something to control this thing with? This is a farewell to my professional mother, to my academic mother, and I'm glad to be giving the lecture. It's a sobering moment for me, very sobering indeed, because she gave me my roots and foundations in neonatology. She blessed me the way a mother blesses a child and sent me on my many professional missions. I shall miss her a lot. Oh, this thing is racing. I will signal you when I want to change. Next. Good. Now, this is where we are. I'll signal when I want to change. This is a legacy lecture in honor of Dr. Angela Anene, now to be called Anene Olisa. In fact, anytime you see Anene, read Anene Olisa, Okolo, Professor of Pediatrics and Neonatology. Next. In today's discussion, we'll be talking about knowledge, compassion, and pursuit of excellence. We'll share our thoughts on those three. Next. And show that the honoree for today, you are revealing my secrets before I get there. Go back one step. We will show that our honoree fully merits to be given a place when people talk about knowledge, when they talk about compassion, and when they talk about excellence. Next slide. Good. Next. So we're going to discuss in three sections. In section A, we'll explore those concepts we spoke of: knowledge, compassion, and excellence. In part B, look at some of the advances in neonatal medicine, newborn medicine that happened in the last 50 years. And then in section C, we'll look at the contributions of Professor Angela Anene Okolo. Next slide, please. Next slide, yes. So in this section, as I said, that's what we'll be looking at. What is knowledge? Next slide. Facts, information, and skills acquired through learning of some sort or the other. It's a theoretical or practical understanding of something or a subject. And today, the subject we're talking of is neonatal medicine. Next slide, please. You see, neonatal medicine does not hang in the air. It is built on a foundation of principles of anatomy. Anatomy talks of structure of parts of the human body. Principles of physiology. Physiology talks of functions of various parts of the body. So when we say we are built on a foundation of anatomy and physiology, we're looking at what are the different parts of the human body, what are the functions of the different parts of the human body. Because something can go wrong with either the structure or the function. And when that goes wrong, we say it is pathology. So we build on that foundation to look at things that may have gone wrong and what we can do to correct the wrong. We don't exist alone. We work with people who take care of pregnant women, the obstetricians. We work with surgeons who may have to operate patients, nutritionists who give advice as to how to feed the patients, and then very importantly, we work with social workers because our patients sometimes carry more problems than their families can afford. So we work with a whole slew of people in neonatal medicine. When I talk neonatal medicine, I'm not just talking of the doctors, the nurses, and the core people who take care of the newborn baby. We have to work with a whole slew of people. Next slide, please. Then the next concept is compassion. What is compassion? It's a feeling that arises when you see somebody who is in trouble, and then you have a desire to help that person. That is compassion. It's related to empathy. The empathy means that I have a feeling, I feel what this person feels, and it stops there. The moment you start feeling like helping, you have moved from empathy to compassion. Next slide, please. Then excellence. No single one word to describe excellence, but it is possession of some good qualities, eminent, unusual degree. You surpass merit, skill, virtue. Excellence focuses on progress. It's not static. You don't stand in one place and say, oh, I have become excellent. No. In excellence, you keep pushing forward. Learn from mistakes, do better in the future. Next slide, please. The mere use of the term pursuit of excellence, teaches all of us to be humble. Pursuit means that there's something in front of you that you want to get. That means you are not yet the best. That means that there's always room for improvement. Anybody who must be called excellent, must continue looking for something better to do. What is new? What is helpful? What is more helpful? How can we do it better? That is the pursuit of excellence. Next slide, please. Then let's see whether these three terms, knowledge, compassion, excellence, are related. Imagine somebody who has knowledge, full of knowledge, but absolutely no compassion. That person will be cold and mechanical. Just come and do things mechanically and go away. That's not likely to be of great help. Or somebody who has compassion, but he has no knowledge. He will make many mistakes. Yes, the heart is good, but he doesn't have the knowledge to carry it through. But when knowledge meets compassion, excellence is produced. Next slide, please. So for those of us who think philosophically, we can look at a metaphor of a three-strand cord, you know, a rope that has three strands in it. What gives that cord, that rope, what gives it strength is knowledge. That's the metaphor of knowledge. But you can't just apply knowledge in a dry manner like that. Sometimes you may have to be flexible, do things differently. And that is the metaphor of compassion. Compassion pushes you to do things differently, not in a rigid way. And then the twist that is in the rope, that is excellence. That is how I would like us to imagine the metaphor of knowledge, of compassion, and of excellence. Next slide, please. Now, take a very good look at this baby. What do you think the mother of this baby will be thinking each time she looks in? See tubes all over the baby's body. In the nose, in the mouth, in the navel. See, you see that one in the right leg? It's not just in the right leg, it's inside the bone of the baby, delivering something. Now, do you think this mother will be very happy and smiling? Definitely not. When this mother is there, and the doctor comes by, and she says, "Doctor, how far with my baby?" We're going to explore the responses of two doctors. Next slide. I will call the first one Dr. Bone. He says, the 27-weeker. 27-weeker means that the baby was born at 27 weeks of pregnancy. So they didn't wait for 40 weeks. Was delivered at 27. So in our slang, we say 27-weeker. I don't know whether that's what you want to be telling a mother. 7 weeks. Well, she's extremely low birth weight. She's extremely preterm. She has respiratory distress syndrome. And we have put her on CPAP. Does this mother understand what we are talking about? They say, well, we're trying. But mortality is usually very high. You heard me. Now, the next doctor, next slide. We shall call her Dr. Hart. When the mother says, "Doctor, how far is my baby?" she says, "Oh, that's your baby, dear little thing." The challenges, but she seems determined to go through. We do all we can to help her along. As you can see, we're still with breathing, we're assisting with fluids, and the next 48 hours will give us a much clearer picture. Now, these two doctors, next slide, said the absolute truth. No lie. They had knowledge. They spoke out of knowledge. But Dr. Boone was dry. He was dehydrated, desiccated. He was devoid of human feeling. Dr. Hart assuaged the mother's pain and left her with some hope. That's the true pattern of compassion. So even though both of them had knowledge, one of them showed compassion. There is a saying in Latin, veritas in caritate. That is Latin for truth in love. So many people in this room will know that is the motto of the best secondary school in this country, St. Patrick College, Asaba. Next slide. So we'll move to section B and look at some of those advances that have happened in neonatal care that have put smiles on faces of people. It's those advances, by the way, that mean pursuit of excellence. Next slide, please. So in the last 50 years, so much has happened, so much expansion of knowledge, so much improvement in practice. In the 60s and 70s, a preterm baby, preterm is a term we use for premature babies. The survival was less than 10%. But today, in many places, it approaches 80% or more. I remember when I was in training, which was, I'm not an ancient person, which was just the other day. When so a baby born at 28 weeks survives, oh, this was news. We were happy, we had done extremely well. Today, if you lose my 28, let me use that term, if you lose my 28 weeker, you answer for you. You have to explain to me what happened because things have improved. And I start wishing sometimes that why were all these things not there when I was training under Mama? Next slide. So one of those is respiratory. In fact, respiratory medicine is where a lot of it has happened. You see that long name there? Don't mind all these doctors, just to confuse people. Continuous positive airway pressure ventilation. It's simply a device we use to help babies breathe. The baby is not breathing well, it's having distress. We put the baby onto that machine and it helps the baby to breathe. That's all it is saying. It was introduced in the 1970s, but you know how long these things take to get to us. Not that it wasn't there, but it was too expensive, too rich for our blood. And it's only now, from the late 2010s, that we started having those machines. Even when we started having them, we started by improvising them. You see that Professor Mukhtar, where is she? Oh, she stepped out for a while. She was one of those that championed the improvised form. FMC Asaba championed the improvised form under Professor Anene Okolo. And taught the rest of us that, look, okay, that expensive machine is not available, but we can do it like this and get results. It was not the best, but it was far better than nothing. That's why I said that I look back and say, if all these things were there are many babies that I personally lost that might have been saved. Next slide, please. Surfactant replacement therapy. You see, don't be listening to this. With all due respect, sir, it's like lawyers. When they start harassing you left and right, you get confused. Surfactant replacement therapy doesn't mean too much. Surfactant is a substance, it's produced by the lungs. That substance helps the lung to remain open so that air can be going in and out. Oxygen will go in, carbon dioxide will come out. But in some cases, especially when they are born too early, they don't produce enough surfactants. So the lung does not remain as open as it should be. Air doesn't go in well, carbon dioxide doesn't come out well, and you find them in serious respiratory distress. But then scientists discovered that if you take surfactants from some animals and put them into the respiratory tract of human babies, and it will work. Now, this became available in the 1980s, but as usual, the costs and all that did not let us get it until pretty late. Even now, where is that Dr. Okonko? He has run away. Aha, that's him there. They are the champions of bringing surfactants to this country at what you might call a cheap rate, but not cheap at all. I mean, at least a mother would say, where is it available? Let me go and sell my wrapper and buy it. So we now have it, but it's expensive. Next slide. I love doctors. Can you see that rubbish? The apnea of premature. It means that the pikin not really breathe. It's not breathing. Apnea means it's not breathing. Don't mind all the grammar. The baby has stopped breathing. The baby has forgotten to breathe. Before, we would give a drug we call aminophylline. And it was helping. That's good. But now, A better drug, caffeine, is available. They belong to the same family, but caffeine is available and it's better than aminophylline. But as usual, it's more expensive. Next slide, please. I tire for these doctors. Antenatal corticosteroids. Hey, you've heard of steroids. You know that one that athletes inject themselves so that they will perform better. But there are some steroids that we can inject into a pregnant mother. The situation has told us that this woman will deliver prematurely. And we remember what I said before. Premature babies don't have enough surfactant in the lung. But if we inject the pregnant mother with some steroids, the drugs will get to the baby, and the baby will produce that surfactant so that that problem we're talking about will not happen. This study, part of this study was done here in FMC under Professor Okolo. You see, when we talk about this one, it's not hyping. We're talking about real events in real people. So yes, once we do that and the baby is born, we find that the baby now has enough surfactant and chances of survival will skyrocket. Next slide, please. We've had a number of people here speak of kangaroo mother care. Kangaroo is an animal. So people like Fajulu have complained that we should not be talking about kangaroo when we're talking of human beings. That after all, what happens in kangaroo care is bring the baby's skin directly in contact with the skin of somebody else so that that person will provide warmth for the baby. And kangaroo mother care, as if the mother is the one condemned to give the care. Anybody can give that care, even the father. You heard the MC saying that Professor Okolo will say, go and remove your shirt and come and give care. All it means is remove your dress, remove the baby's dress, skin to skin with the baby, tie the baby to yourself, and your body will supply the warmth that the baby needs. There's no cost in this one. There's no cost involved in this one. But why didn't we know this all along? After all, we have been seeing kangaroo for ages. And that is how kangaroos take care of their newborn babies. You can see that mother giving kangaroo care. Next. Those are some of the advantages. Apart from providing heat and warmth to the baby, it stabilizes the heart rate of the baby, the breathing pattern of the baby. It enhances breastfeeding success. If a baby is lying on the mother like that all day long, it enhances suckling and the chances of breastfeeding success, reduces stress. I know some of us here will run home and say people should be giving them kangaroo care. We're not giving adults kangaroo care. All right, so those are the advantages. Now, nutritional support. This one is a bit technical. It's technical because in some sicknesses, it's too much to put food in the mouth, the stomach, and so on. We say bypass the stomach, bypass the intestines, let them rest, let them mature. So we have to give every nutrient through a drip. Simple forms of protein, simple forms of carbohydrates and all that. But in order to do that, we need to be supported by technology, especially monitoring technology. So this is not it's not advanced with us yet. We practice it in small forms, but not the real advanced form. Oh, next slide, please. The next slide. Targeted temperature management. It had an old name who doesn't mean anything to you or to anybody. You see, sometimes a baby is born. You know, when a baby is born, the first thing the mother wants to hear, the first thing the relations want to hear is a cry. Baby has cried, that's it. But some babies would not cry, they have problems. And everybody starts running around to see what we can do to get the baby to start breathing and to start crying. Sometimes the event may have happened somewhere else. Then they will carry the baby inside a taxi, on top of Okada, wherever, and race to come and meet you in FMC. By the time they get here, 3 hours have passed, if you are lucky. Sometimes they get there in 12 hours, in 24 hours. But if you are lucky, and it's less than 6 hours, the baby was born. Our minds work quickly. 3 hours, baby was not getting good oxygen. Some chemical reactions would have taken place in the body. Those chemical reactions will produce some rubbish substances that we call radicals. Those radicals can affect the brain. What can we do? Let us slow down the reactions in this baby. We cool the baby down. The temperature, which should be around 37 degrees, we cool it down to 33 degrees, to 34 degrees. When you do that, the reactions also slow down. Those radicals are no longer produced the way they would otherwise have been, and then the damage to the brain is controlled. Again, it's a high-end technology thing. It's not yet our thing to do here, but we're looking forward that someday the likes of Okolo will do something about it. That's targeted temperature. Okay. Now, section C, quickly. Next. In section C, we promised to talk about the contributions. Next slide, please. Of Professor Angela Anene Okolo. The unfortunate thing is that one lecture is not enough. But what can we do? We don't even have a full lecture. You see now, it's only one small part of the lecture that I have to talk about her. She was there very early at UVTH Benin when neonatology was not a favorite subject. Dr. Ngozi will tell you, people ran away from newborn medicine. Those tiny things, you don't know where you will touch the baby. Carry the baby Okolo. But she was there. She stood firm. When people shied away, she showed deep interest. And that is why we are gathered for her today. Next slide. For years, she carried the burden of newborn care. She defined newborn care in Benin, and I dare say in the entire country. There weren't many places that had strong newborn care at the time I was in training, but Benin was certainly one of them. Next slide, please. He rendered unparalleled, selfless. We have heard all this from people. All those things they were telling you. All of them are true, nothing. Those of us, many of us parading ourselves today as neonatologists, we owe it to her. Next slide, please. Let's just keep moving. Because people have told us, yes, we've heard that she went to Jos. She took, I hope Dr. Ngozi will not feel offended. She took civilization to Jos. Civilization to Jos before returning to Benin. Next slide, please. Let's keep moving. And we have had a series of first this, first that, first the other. What I just want to emphasize this one. I'm the first woman to reach the rank of Professor of Pediatrics in this country. Yes, Professor Okolo. And for a very long time, she was the only woman professor of neonatology. Before them, Fajolu, wave your hand. Mutar, before those ones, open eye. The woman don't date there alone for a long time. Next. I'm not the one, sir, Dr. Omo, that will tell you what she has done. But for the sake of the record, so that people will hear, she proved that she still had a lot to give after retirement. Community-based care, community-based research, she was deep into it. Why do I talk of community-based research? All right, I was chief examiner for pediatrics in the West Africa College, and I received theses and dissertations that people wrote. If you line up community-based research thesis, bring them all out, you will find that the majority were supervised by Dr. Professor Angela Okolo. In fact, in the beginning, some of my colleagues did not understand what was happening. All we knew was patient on bed 7, patient in room 5. Okolo said, no, you want to solve a problem? Don't wait for it in the hospital. Go to the community where the things are going wrong and solve the problem there. That was Angela. Next. Now, in FMC, the CMD told you there's a state-of-the-art neonatal intensive care unit. Courtesy of her. The National College sent me here to come and on an accreditation visit. Now you remember that we visited you on that occasion. What I saw was a marvel. I come from Lagos State University Teaching Hospital. I know we have a good neonatal unit. Therefore, we were the first to receive accreditation, but FMC was the second to receive accreditation. CMD, sir, it's not my job, but I put it in view. I put it in view in the presence of Unago. I strongly recommend that building be named after her. Next slide. So you see all those things that we were mentioning, I was trying to explain to you, the new advances and all. She brought all of them to FMC Asaba. If it is available anywhere in this country, it's present in FMC Asaba. So whether it is helping babies breathe using CPAP or using surfactant or whatever, we have Professor Okolo to thank for all that. Next. A trainer par excellence. I think I should stop reading this thing and just trainer. I attended her school. I am an alumnus of Professor Angela Okolo. And I dare say that I'm the first product of that school. I don't know if Sam made it here. Professor Sam Sebo, I expected him here. He graduated right after me in the school. When Okolo supervises you, you stand supervised. I'll just tell, it's a brief story. She supervised me, and when I was defending my thesis, one of the examiners said, well, you've put together everything, but there's one sentence that if you put it in this book now, you move from provisional pass to full pass. Where is that statement? You didn't write it. Okay, I'll write it. Okay, go and make your correction. 3 months, come back, and you just send your book back, and you get your full pass. When I go back to Benin, I found it very difficult to tell Professor Okolo. But I had to report to her what happened. Oh, they say I should put a sentence on so and so. She's packed. It's in your book. It's in your book. Why didn't you show them? Then I looked at her and said, Madam, when I went back and looked at the book, I thought it was necessary. I thought it was unnecessary, so I removed it. So I bet make I speak this one. Let me ask her to speak this one. Anya Olomungosiwo. Oh, the way she stared at me that day, as if to say, this man, what will I do with you? I advised you that this sentence was important. You went home and told yourself it was not important. Now it's other people that are telling you, as if I'm not there to advise you. I felt sorry for myself that day. But that's the way she was. The supervision, how many people had computer? Nobody had computer. If you want to analyze your work, you sit down with a calculator. But Uniben had acquired, computer room. But this lady, took my results to Unibrin Computer Center, analyzed, and brought the results back to her. When I realized that what she had done, I said, hey, where am I going to find money to pay computer center? I said, very timidly, so, madam, how much do they expect to pay? She looked at me, expect you to pay. I paid. Huh? You have paid. I will confess, I shed tears in her office that day. When we talk of compassion, it's not fairy tale. But I will also tell of twice when we disagreed. The first time I went away, I went to the person who was sharing. I said, I don't want to work with Professor Okolo again. Send me to another unit. Then the report got back to her. So she summoned me. I spoke in Asaba. Nana Ninebo, sit down there. I sat down. Then she went through what I had done. The more she narrated, the more I was lowering my eye. Then she said, who knows you? I'm the one they will ask. They'll say, where were you when the son of Njokanma was doing so and so? What do I want? She's not going to answer questions. So. Therefore, she was straightening me and I was doing the correct thing. Now you get up from that seat and go and tell them to post you back. Now, I was a medical woman. Yes, medical woman. Anytime people had feasts in her house, I was there. I was the first person to arrive. So I did chop well, cake, all kinds of things. But there was a day she entertained, some people from the university. All I had to do was hear that she was going to be eating in her. I arrived there. So when professors and doctors and all that were sitting somewhere, I couldn't sit on the same table with them, so I sat somewhere. Kai, I was eating this thing. I think she called it pea soup or something like that. And the children, I looked at that, I said, hey, this soup. I was not enjoying it at all. But I said, if I say now that I don't like this soup, they'll say he's a bushman. He's a bushman. So I just kept, after some time, how many of you here know Professor Ajovi's Coffee Marco? And Marco just pushed his plate. Angela, what is this thing? I'm not eating again. The other people quickly push their plates. The woman said, look at you. You have to have a cultured palate. Is that not the same thing that Fidelis is eating? I just got the mic and said, Fidelis will eat it now. He doesn't have a choice. So that's it. I have many tales to tell about her. I'm sorry, time will not permit me to tell all of them. Next slide, please. We have heard all the things, all the things she shared, and next slide, please. Secretary, faculty, everything. We have heard all these things. She rendered superior service to both National College and West Africa College. Next slide. Well, I mentioned this before, that there is only one prize in the National College for Doctor of Medicine degree. She endowed that prize. That is why I decided to honor her today by wearing my Doctor of Medicine gown. And I'm sure that's what Professor Fajolu had in mind when she put on her own. Next slide, please. So it's only fitting that she got that gold medal award. Gold medal from the West Africa College. She was distinguished pediatrician. Was it 2013? Awarded, was it 14? 14. So she was distinguished pediatrician. Next. Nigerian Society of Neonatal Medicine. This morning, when I was going to put on my tie, I said, I brought out the Nigerian Society of Neonatal Medicine tie. I said, if I put on that tie, pediatricians will kill me. They say, only neonatology is a woman born. So that's why I put on the Pediatric Association of Nigeria tie, so that the rest of pediatrics will not kill me. Next slide, please. Yes. Those of us who are philosophers, what's the shape showing there? The heart. You need a kind heart, a compassionate heart to take care of that newborn. Can you see the tiny feet of the newborn? That is Angela Okolo. She dedicated her life to those newborn babies and their parents. Next slide. Yes, she lived a devout Catholic life. Nice. Not me will tell another one now. You already know that. She was a lady of St. Mulumba. And there's something I have smuggled in there. Because it is true though. One of the social clubs in this town is called Summit Club of Asaba. I happen to be president of that club, and she is one of our patrons. If Nago will not mind, he also is a patron of that club. Next slide. So we're holding this lecture to mourn her extremely sudden passing. She remained active until the very end, having, as we were told, just returned from a conference in Abeokuta. As usual in Abeokuta, she was the life of the party. Next slide. We have heard all these ones. Next slide. Next slide. We shall miss her a lot. We shall fondly and reverently remember her forever. May her memory be a blessing to us all. Mama, next slide. That's her. Okay. So, thank you, ladies and gentlemen, for listening. Thank you. Thank you. Thank you. Please keep jamming those hands. Keep jamming those hands. Thank you very much. You may please be seated. Thank you very, very much.